Good evening. Thanks for joining us. It is being called a monumental shift in drug policy. Tomorrow, BC will become the first province to decriminalize small amounts of hard drugs. This comes as about 20 people a day die in this country from toxic drug overdoses, here more than anywhere else. CTV's Binder Sudjan reports on the change and what's being done to protect children.
As the epicenter of a toxic drug crisis, BC will become the first province in Canada to allow adults to carry 2.5 grams of opioids, cocaine, meth, MDMA, and avoid arrest. Instead, they'll be given cards connecting them to social services and addiction supports.
Instead of being treated as criminals, they will be treated with care and compassion.
The federal minister of mental health and addictions making it clear the import, export, production, or sale of drugs could still land you in jail.
This exemption is not legalization.
Unlike cannabis, the drugs won't be sold in stores. For years, police departments in the province were letting simple possession slide. Now, the drugs won't be seized either.
We're really hoping that those interactions are obviously non-criminal and positive and helpful in nature so that we can stop these overdose deaths.
Measures to protect kids include keeping it illegal to possess the drugs in schools, childcare facilities, and vehicles operated by minors. More than 10,000 British Columbians have died since 2016, when the emergency was first declared, including Catherine Botchford's husband, leaving 3 kids without a dad.
I was with Jason for 17 years. So when I discovered how he died, I thought there must be a mistake. Jason doesn't do drugs.
Advocates say more still needs to be done, including providing a safer substance supply.
Decriminalization as a response to overdose is a drop in the bucket and not a sufficient response, but it is an indicator that there is political and social will to make steps to address this.
Drug User Liberation Front sells drugs made and tested in BC to members at cost. The unsanctioned trial helps 40 people on Vancouver's downtown east side. Co-founder Jeremy Calicum says many of them report they're using less and overdosing less.
They're getting more what they need and aren't getting ripped off. They're having less interactions from police, having to do less crime to pay for their habit, if that is what they're doing.
BC's government acknowledges this is just a start.
This is one tool in the province's fight against this ongoing public health emergency.
And Binder joins us now with more on this. So, Binder, how will the public know if this program is working?
Yeah, well, BC and Ottawa have committed to sharing data with the public through a quarterly dashboard. And of course, the hope is that in the months before that happens, we will start to see the number of overdose deaths decline. Now, we're told it's going to take a couple of months for that dashboard to be up and running, but we should see something later this year. Mi-jung?
Well, hopefully we do see some positive results. Thank you, Binder.